Governor Cuomo, welcome back. You were talking about what you needed from the federal government, tracing and contact. Let me do a quick follow-up here before I hand it back to Katie. This issue of state funding, and look, I think that, every state is going to have their own funding problems as this cascades, whether you're a state that has income tax, tourism revenue, casino revenue. We can go through all of that. But are you ready, or do you think you're going to have to go before Congress, go before a committee hearing to make your case publicly?
Oh, look, they have no case, Chuck. They have no case. You want to bring back the economy. How are you going to do it without bringing back the state economies? You wanted to fund small business, but not police, not fire, not school teachers. You want us to do the reopening, but there's no funding for it. They have no case. They're bailing out blue states. You want make this a partisan issue? Why, Republicans don't die from this virus? You want to really talk about bailout? New York State gives $30 billion more per year. Mitch McConnell, Kentucky, is one of the biggest taking states. Florida is one of the biggest taking states, $30 billion more than they put in. They don't want to have this conversation.
Katie?
Governor, I want to jump in and ask about what's going on with kids in this disease. Yesterday, we had a report about an inflammatory infection that was affecting kids that seemed to be linked to COVID-19. WNBC is now reporting that 64 children in New York State have now presented in hospitals with a serious pediatric inflammatory syndrome that, again, is believed to be linked to COVID-19. What do you know about that, and has that potentially caught your health department off guard?
Well, I don't think it's caught anyone off guard, Katie. It's developing now. Apparently, they had a couple of cases in the UK on this. We're looking at it in New York. The information is all preliminary at this time. We're talking to some individual hospitals that have some cases that they're questioning. But it looks like, and again, preliminary, but young children who either test COVID positive or test for the COVID antibodies, which suggest they had the virus, which have an inflammatory response. It's not really respiratory. It's more in the blood vessels themselves. Where they have an inflammatory response to the virus or to the antibodies. I don't believe there's been any fatalities from it, but it's something the Department of Health is looking at.
What is the message to parents out there who might be waking up? I mean, and I say this from personal experience because I mentioned this yesterday. I woke up and my 1-year-old son, had a rash all over his body. And as a parent living in this time, I got very freaked out by it. And I contacted the pediatrician. It's supposed to just be hives, they think. But what is your message to parents out there as they are highly alert and attuned to what's going on with their kids?
Yeah, no, they should be, Katie. And look, the truth is, anyone who tells you, well, we know definitively what's going on, I don't think anyone does. I talk to all the experts around the country, all around the world. I don't think anyone knows exactly what they're talking about. I mean, the more we learn that we were wrong, right? Now they're talking about the virus may have been here last year in November and December. CDC just announced that the cases on the East Coast came from Europe and not China. So much of what we've heard turns out to be wrong, frankly. So I understand why parents would be anxious. I think everybody should be. This is still a developing situation, and we don't know all the facts.
Governor, I want to talk to you about sort of the mid to long term solution. And we've talked a little bit about this before, and we had the head of the Transit Authority on earlier today about this, and that is sort of the Manhattan business climate. Are you concerned that some big companies might say, you know what, I cannot have this many employees this tightly, I'm just not going to bring them all back. And it's not just a temporarily so. I'm going to disperse, I'm going to have the same amount for my company, but I'm going to disperse it around. Are you concerned about that kind of long-term economic impact for Manhattan? And if so, what are you telling these CEOs to make them feel better?
Yeah, I don't think I hear the potential issue, Chuck. I haven't heard it. I don't believe it's an issue. This is not a New York-centric issue. This is a national issue. It's a global issue, obviously. To the extent New York had more cases than most areas, I think now we understand what happened when the CDC came back and said, well, the cases were coming from Europe. You know, everybody was watching China travel ban. And obviously the virus left China and went to Europe. And then we were bringing in over 2 million people from Europe. And the federal government, the global organizations, nobody gave us an alert. So all those people came over from Europe. They landed in JFK or Newark. And now you see the cluster in the New York metropolitan area. Plus you put it together with the density. If we were going to have that issue, Chuck, it would have been after 9/11. Where obviously New York wasn't alone on 9/11, but that was, New York was targeted, right? And if that was going to be the response from business leaders, it would have been after 9/11, I believe.
Fair point.
We have a report coming up in just a moment, Governor, on nursing homes. I'd like to get your answer on this. There's nearly 5,000 deaths now in New York State that are being that have come from nursing homes. I think it's 4,800 is the more exact number. What is the state doing in order to ensure that those who are in those homes are being kept safe? There are people who run these nursing homes who are saying that they need money from the state government or the federal government to have their care workers live on site so they can create a protective bubble around those nursing homes. There are others who have said, hey, listen, we need the help of the National Guard. What is New York doing?
Yeah, look, for the nursing homes, Katie, are the place that has scared me most from day one, right? We were introduced to this virus in the state of Washington at a nursing home. You have the most vulnerable population in a congregate setting. So it is ground zero for this virus. We have done everything that we can, to tell you the truth. We've actually taken actions that I wasn't comfortable with, but my health experts said were mandatory. We have no visitors going into a nursing home. Can you just think of that? You're in a nursing home and we have no visitors because it's so hard to stop this virus. We're testing all the staff that works there, providing PPE, et cetera. Our rule, if you will, is very simple. If a nursing home believes they cannot provide adequate care for the person for any reason, they must transfer the person. And we have facilities and beds, and we have COVID facilities for people from nursing homes. So it's up to that nursing home. If they believe they can't adequately care for that person for whatever reason, then that patient has to be transferred. Now, having said all that, you can put whatever perfect, quote unquote, system in place because there is no perfect system. All it takes is one person to walk into that nursing home, one facility person, one staff person that doesn't test positive. And once the virus is there, it's ravaging. It is just ravaging. So do everything you can, but understand that you're not really going to ever be able to stop this in a nursing home. We lost 230 people last night, not because you didn't have the best hospital care and the best nurse and the best doctor. Sometimes the virus wins. And when you're talking about a senior population, vulnerable people, the success rate of that virus goes way up.
It is just terrifying to have a loved one in any sort of facility, any sort of help facility, a nursing home, special needs facility right now. Governor Andrew Cuomo, thank you so much for joining us today, and thanks for bearing with us with all those technical difficulties. We appreciate it.
Yes.
No, my pleasure. Thank you. Thank you for what you're doing, Katie, Chuck.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.